Hello, everybody. My name is Jean Bastilla. I am with AWC and Home Care. Um, I'm a family practitioner. I've been working for them, or with them, if you want, for several years. The reason I've decided to start those videos, it's because of the requests that I have from visiting so many of my patients, or if you want, clients who need home care. And I realize how many questions or how many issues they have in as far as finding somebody to provide home care. As my role in the community is a role of an educator, so I have decided to put some educational videos together to educate people about home care, to talk to them about options, because as we all know, as we age, we have aging parents. We at one point will need somebody to help us with some type of home care needs. So that's the reason why I have decided to put those videos together, and we'll try to do this on a regular basis. We'll be talking about different topics, and we'll be also asking you guys what are the topics that interest you the most. We'll be able to answer many questions as far as home care services, because a lot of the time you have parents, they get older, and now you're looking at what are the options, and most of those people, they would be like, well, I don't know what do I do. And when you go there, those people, they really have no clue what to do. And in a lot of situations, if they are educated based on their options, then it makes things a little easier for them. So this is my job. My job is to try to help you guys by coming up with education, by coming up with different ways or different options of home care. So first of all, let's talk about home care. What is home care? Well, home care is a service that is provided to your house. I mean, again, it can be in the hospital, in a facility, but mainly in your home. And it's mainly provided to the elderly, or maybe somebody who had an accident. So sometimes they need home care, which a lot of the time it's a situation that is not really planned. So we don't know whether it's going to happen. But this is really what home care is. It's really somebody coming into your home to assist you. I know a lot of the time there's a little confusion as far as home health and home care. So the difference is, home health, usually if you go to the hospital, you admitted, you have saying you had an infection, you had a wound infection, for instance, or you had surgery, they may send a nurse just to help with doing some dressing change or things like that. Whereas home care, usually it is a service that is non-medical, that somebody who comes in, usually a CNA or a sitter, they just come in to keep you safe in your home. This is just an option that kind of helps you stay in your house instead of going to the nursing home or assisted living. So this is kind of the difference between the two, because a lot of the time people confuse home health with home care. But home health is really, and the other difference too is, usually home health is covered under most of the insurance companies, as well as if you have Medicaid, any of the government insurance would also cover it. Whereas home care, usually it is an out-of-pocket cost, you know. So now, why are we talking about home care? Why is it important? Well, when you look at different statistics, I wish we had an option to provide home care to most of our elderly people, because what you see is, we spend so much money to pay hospital expense, hospital visits for those people. Whereas if we were able to provide them with home care, they would have been able to stay at home safely, and we would not have had to pay so much money and trying to get them because I have seen several situations. I work in a hospital, so a lot of the time people comes in, they were having a good life at home, they fell. Well, This we could have prevented this by just providing them with somebody to take care of them at home. Because you're looking at if a fall from home, I mean, that's a lot of money. Because if you come to the hospital and you tell me you had a fall, hey, I'm gonna have to order like a CT scan, MRI. I mean, it's several days in the hospital sometimes. So it's like, and sometimes bruised, sometimes they have broken bones, and you're talking about the elderly mainly. So a lot of the time, those people, the other issue is they are already frail. It's very easy that they can be in the hospital bed and develop pneumonia, for instance. So providing somebody to come to their home to assist them actually is the best option. I mean, I wish we could do this for every one of our elderly people. I mean, if you look at the benefits they get by staying home, well, first of all, they are able to stay in their environment, a place where they know, where they feel comfortable. Nobody would like to leave their home. I mean, it happens. Hey, they don't have a choice. But most people would like to stay at home where they feel comfortable. You know, number two, if you keep them at home, as long as you have a sitter with them, usually that sitter is there to help them. It should be kind of a one-to-one interactions, one-to-one ratio. So therefore, you don't worry about your mom, your grandma falling, and they end up in the hospital with pneumonia and end up sometimes don't even make it, or end up in a nursing home. So it's a lot of benefits. You know, they help them clean up. So it's really, if you look at all the benefits for keeping somebody at home by using home care, it's amazing. It's really amazing. So for that reason, I think it is important that people are educated about home care. Well, the other issue with home care, because the in-home care service is a private service, so usually the cost is an issue. You know, it costs a lot of money to be able to pay somebody to come every time. Well, what I usually do to many of those clients that I have encountered, what I usually tell them is, let's use it. Let's make sure we use the fund that you have at the very best, which means let's see when you need those hours the most. When does grandma fall the most? So we look at statistically what has been happening, and that kind of helps us to determine how much help they need, and how should you address them. I'm going to give you a very simple example. I have several clients who are using our home care services. They only use us for like 4 hours, maybe 1 to 2 times a week. So what I do when I come, I sit with them, we discuss a plan. Okay, we said, hey, let me see what's going on. So they would tell me, they say, hey, you know, we don't have as much money, but many of them saying they have COPD or they have some issues that prevent them from having the energy to cook their meal, for instance. I've seen that a lot. So people would they just cannot. If they stand up, they get up, they cook their meal, now they have issue of being able to eat it because they feel so, they lost so much energy by preparing the food. So what we do, I'm like, okay, let's come up with a plan. So I would send them somebody, I would send them a sitter. The sitter would go there. If they go on Monday, they would cook food and they would box it up for them for the next few days. So with that, they don't need somebody to be there in their home every day, because again, home care, it depends on how much need you help. And that's why usually we come in for a free evaluation to see how we can help you, because with very little money, you can actually keep somebody safe at home. I mean, I understand sometimes you need to get the full 24-hour care, but it may be just 4 hours on a week. Saying somebody who needs somebody to come in, just help them clean up their space. Okay, that's all they need. Otherwise, they may be on a wheelchair, but they kind of able to maneuver things, or they may be using a walker, but they're doing pretty okay. But what they don't want to do is to try to go and clean up their apartment or their house, and then they fall in the process. And now you are using a wheelchair. Now you are in a hospital bed, or you are using a walker, now you're on a wheelchair. So this is what you don't want to happen. So they may get somebody in there just to help them with the cleanup. Get somebody in just to help you with what you cannot do. I mean, they don't have to be there for a long time. Just for 4 hours a week, you get somebody in there. They help you do your cleanup. They help you cook for the week, or maybe, you know, twice a week. They kind of help you with all your meal and help you with your cleanup, keeping your house clean and everything. Help you when they come in. They can also help you maybe if you need to pick up a prescription or something. At least they help you, but it doesn't have to be a lot of money, because a lot of time people are thinking, oh, it has to be so much. But no, it does not. It can be very minimum amount that you pay, because if you look at it, what if you fall? You know, again, it's not a wish, but it can happen, and I've seen it happen. So this is part of the purpose of what I want to do. This is something that I personally, I have a very, I'm a very big advocate for people to stay in their home. I know nursing home, hey, it's a good thing that we have that option, but I hate to see some people who could be independently, or at least assisted by somebody to come in. They could be happily staying in their own home, and they are pressured to give up their home. So our job is to come there and sit with those people and educate them and talk to them and say, hey, I know you wanna I know you're trying to find a way to stay at home. Let me see how I can help you. So what we do, we go ahead and sit with them and see how we can help them, what we can do to make the environment better for them to stay at home, and how we can help them so they don't fall. We come in, and I personally, most of the time, I personally come in and create a care plan to make sure that they get what they need to stay safe at home. So really, that's really what we do. So at the end of the day, I would always say, if you are at home, or you have your parents at home, you're worried about them falling, you're worried about them hurting themselves, you're worried about them turn on the stove and put the house on fire, or you're worried about them taking the wrong medication, hey, at least give us a call. Let's talk. Let's see, maybe there's a way we could help you. Maybe not, it is not going to cost you as much as you think. Maybe we can kind of work with you with what you have, because I mean, not everybody have the same resources, but they don't have the same resources. Our goal is to help them to stay at home. So you talk to us, and we could sit with you, and maybe we could come up with some type of options. We could give you some advice. I mean, hey, that's what we do. We do education. Call us. We'll be more than happy to talk to you. We'll be more than happy to advise you on what we think you should do. So this is what we do. This is a job. So thank you for watching this video. I encourage you to share it with other people. We'll definitely be coming up with more videos, more topics. If there's a topic that you want us to talk about, if you have any question about home care, about any situations of your parents or yourself or your grandparents who have any situations with their living condition, please let us know. We'll be more than happy to answer your questions. We'll be more than happy to help you come up with options. Again, I think our number is below the screen, but it's 678-696-9905. Again, it doesn't cost you anything to just let us come in and let's talk to you. Let's discuss to see how we can help you. So again, thank you again for watching this video, and you guys share it, like it, and I will see you all next week for another topic. Thank you.